Hi, welcome back to another YouTube exclusive video. I'm Laura Hatch, the founder of Front Office Rocks, and I want to talk about a question that I just got from a client of ours. And I've heard it come up a lot in Facebook groups and different conversations, and that's about assisted hygiene. Do we like it? How do you schedule for it? Is it good for the practice? And I have mixed thoughts on it. We didn't do it in my practice, but I get the concept of it. I think there are scenarios where it makes sense. So this client, for example, they're in a place where it's hard to find a good hygienist. Like it's hard to find a hygienist, I should say that. So to get as much hygiene production as possible, they need to look at doing assisted hygiene. So in that case, I could see the reasoning behind it. Now, on the flip side, I'm not a super big fan of assisted hygiene because the number one complaint patients have about us is that the bigger we get, the more they feel like a number. When they first started with the practice, they felt like family, and now they feel like a number, get them in, get them out. Assisted hygiene could feel that way. And we only get to see some of our patients every 6 or 9 months. 6 or 4 or 3 months, maybe 9 months, who knows. And we want to remind them every time they're in why we're amazing and why they chose our practice. So if they come in for their cleanings and we're being so efficient that we're getting them in, getting them out, getting them in, getting them out, and they do feel like a number, we could jeopardize our long-term relationship with our patients. So that's my concern about assisted hygiene. Now, what I would say is if you're considering doing it, or if you have it in your practice and you're looking to improve, here are just a couple tips that I have about it. First of all, the hygienist has to be on board to do it. I'm not a hygienist. I've never been clinical, but I gotta imagine it's a lot of work, right? Because they're just going from one patient to the next patient to the next patient to the next patient. And there's really not a lot of downtime. There's not a lot of talking. There's not a lot of building rapport. So the hygienist has to be on board to do it and like it. Otherwise, they're going to get burnt out or they're going to show that they're not very happy with it. Sometimes it has to be done, so that's just part of the job, but you want to make sure that your hygienist understands that. The second thing is what I was talking about earlier, that patients feel like numbers when they come in, like just get them in, get them out. So if you're going to do assisted hygiene, you have to have an amazing dental assistant, which I know there's a ton of amazing dental assistants out there, but your dental assistant really has to fill in the gaps where the hygienist isn't there any longer to do that. I believe every time a patient comes in, we need to build rapport. We need to make sure that they remember why they picked us. We need to make sure that they love us, that we're going over home care, all of the things that are super important for their 6-month or 4-month or 3-month appointment. And our assistants now need to step up for that, which is amazing for dental assistants. If you're an amazing dental assistant, you've got a great personality, you've got great clinical skills, bedside manner, this would be perfect for you. But if you're just going in, doing the job and leaving, and you're not super great at building rapport with the patient, reminding them why they love you and your practice, that could be challenging. So those are my kind of 2 main areas, is just make sure if you're doing assisted hygiene, the whole team understands why, specifically the hygienist, and they're on board for it. And then secondly, that you guys are doing everything you can to still remind the patient why they chose your practice, why they love you, and build that rapport and continue that rapport with them every single time they come in. If you could do those 2 things and work as a team and everybody come together, assisted hygiene is amazing. If you're lacking in those areas, I definitely would take a step back and look at that to make sure you improve in the areas that I just talked about. So again, I'm Laura, and this is our YouTube channel. Subscribe below if you have more questions or thoughts or want to hear when I bring something else up that a client asks. And thank you for a few minutes of your time. Have an amazing day.